Did you know that nearly 1 in 5 babies develop flat spots on their heads by the time they're 4 months old? That's a lot of little ones who miss out on a critical part of their growth, tummy time. But here's the shocking part. Babies who don't get enough tummy time are more likely to face developmental delays, like trouble crawling or even sitting up. Tummy time is one of the simplest but most powerful exercises you can do to support your baby's growth. In fact, research shows that babies who get regular tummy time are more likely to hit major milestones earlier, like lifting their heads, rolling over, and even crawling. In this video, we'll reveal the must-know tummy time positions that can change your baby's development for the better. From beginner tips to making tummy time fun and avoiding common mistakes, this guide will have you feeling confident and empowered. Stick around until the end to learn how you can make tummy time a game-changer for your baby's future. Chapter 1. The Power of Tummy Time, Why It's a Game-Changer. Tummy time isn't just a cute exercise for babies, it's a vital practice that helps them grow stronger and healthier. Research shows that babies who spend time on their tummies develop essential motor skills faster. Studies indicate that babies who practice tummy time regularly show improved neck and back strength, which are crucial for rolling over, crawling, and eventually walking. In fact, the American Academy of Pediatrics, AAP, recommends tummy time for babies as early as the first few days of life. It's a powerful way to support their muscle development and help prevent flat spots on the back of the head, known as positional plagiocephaly. If you've heard about the Back to Sleep campaign, tummy time is its partner in ensuring a healthy, well-rounded baby. The benefits of tummy time don't stop at physical strength. It's also linked to cognitive development. Babies who engage in tummy time have been found to be better at problem solving, as it encourages them to use both sides of their brain. Studies reveal that babies exposed to tummy time for even just a few minutes each day tend to reach developmental milestones ahead of schedule. What might surprise you is that tummy time can be a bonding experience. As babies strengthen their muscles, they start to make eye contact, smile, and engage with their parents. So, not only is tummy time crucial for growth, but it's also a special time for connection. Dr. Harvey Karp, renowned pediatrician, says, tummy time strengthens the foundation for a lifetime of movement, from crawling to walking and beyond. The secret to success with tummy time is consistency. It's not about long stretches of time at once, it's about making it a part of your daily routine. Start with just a few minutes and gradually increase the duration. The goal is to build strength over time, not to overwhelm your baby with too much at once. By using tummy time to build a solid foundation of strength, you're setting the stage for future milestones. Chapter 2. Tummy Time for Tiny Humans. The ultimate beginner's guide. Starting tummy time with a newborn may seem intimidating, but it doesn't have to be. One of the best ways to introduce tummy time is by making it a gradual experience. Experts recommend starting tummy time from the first few days of life, even if it's just for a minute or two at a time. At first, your baby may not love being on their tummy, and that's okay. Newborns are still getting used to their surroundings, and tummy time might feel uncomfortable. However, persistence is key. Research suggests that even brief tummy time sessions can lead to improved muscle strength. The AAP encourages starting small, perhaps right after a diaper change or a short while after feeding when your baby is awake and alert. A helpful strategy is to begin tummy time on your chest. This position, known as chest-to-chest tummy time, is comforting for babies because it's close to the warmth and safety of being held. Plus, this position allows your baby to practice lifting their head while feeling the support of your body. If your baby is fussy, try a gentle rocking motion while they're on your chest to help them relax. Another tip for beginners is to use a soft, engaging surface during tummy time. Lay your baby on a colorful play mat or blanket, and place soft toys within their reach. This encourages your baby to lift their head and stretch their neck in an effort to see and interact with the objects around them. A study from the University of Delaware found that babies who engage with toys during tummy time show better coordination and visual tracking skills. Don't forget about tummy time in the first few weeks. It doesn't have to happen on the floor. You can also hold your baby upright in a sitting position while supporting them, helping them practice using their neck muscles. This position can ease the transition into full tummy time later on, without the initial discomfort. You might wonder, how much tummy time is enough for newborns? The general guideline is about 15 minutes a day. That might sound like a lot, but it doesn't have to be all at once. Break it up into smaller sessions. Start with 1-2 minutes per session and gradually build up to the recommended time as your baby gets used to it. Chapter 3. From Crying to Smiling. How to make tummy time fun. Tummy time doesn't need to be a struggle. The trick to success is making it fun. Babies are naturally curious, so by using stimulating toys and playful techniques, you can keep your little one entertained while they strengthen their muscles. According to pediatric occupational therapist Dr. Laura Prager, tummy time should be a rewarding, joyful experience, not a battle. One creative strategy is to use mirrors. Babies love looking at their own reflection, which makes a mirror an excellent tool for tummy time. As your baby practices lifting their head and chest, they'll be fascinated by their reflection, which keeps them engaged longer. A study published in the Journal of Developmental and Behavioral Pediatrics found that babies are more likely to enjoy tummy time when they have something visually stimulating in front of them. Another way to make tummy time fun is by singing or talking to your baby. Your voice is comforting, and it helps to make tummy time feel less like a workout and more like a playtime activity. Sing their favorite lullaby or simply chat about their day. The sound of your voice will encourage them to look up and engage with you, which strengthens neck and back muscles. You can also use toys with bright colors or textures to capture your baby's attention. Rattles, soft plush toys, and crinkly fabric are excellent choices. When babies reach for toys, they're working on their coordination and strengthening their arms, shoulders, and neck. Incorporating gentle encouragement can also help. If your baby starts to fuss, offer gentle praise when they attempt to lift their head or even make small movements. Celebrating these tiny milestones boosts their motivation to continue. Dr. Karp emphasizes that positive reinforcement, even for the smallest efforts, encourages babies to push themselves further. Lastly, don't forget to switch things up to keep tummy time exciting. You can change the environment, whether it's moving to a different room or using a different blanket or mat. This keeps your baby curious and engaged. Research suggests that novelty can enhance a baby's attention span and encourage exploration during tummy time. Remember, tummy time isn't about perfection, it's about consistency, creativity, and making it an enjoyable experience for your baby. As Dr. Harvey Karp puts it, every minute of tummy time counts in building your baby's future. Don't forget to subscribe to our channel for more helpful tips on parenting and baby development. Chapter 4. Unlocking Superpowers. Tummy time positions for growth. Tummy time isn't just about lying on your stomach, it's about using different positions to help your baby grow stronger. The right positions can make a big difference in muscle development and coordination. The key is variety. By changing how and where your baby spends time on their tummy, you can challenge them in different ways. One effective position is the tummy time on a ball. This involves gently placing your baby's chest on an exercise ball while you support their body. The movement of the ball encourages balance and strengthens the core muscles. Research from the American Journal of Occupational Therapy shows that this dynamic position helps babies build muscle control more effectively than flat tummy time alone. Another great option is tummy time on a pillow. Place your baby on a soft pillow or cushion, so their upper body is raised slightly. This creates a gentle incline, making it easier for them to lift their head and engage with their environment. The change in angle makes tummy time feel less challenging, which is perfect for babies just starting out. If your baby is more advanced, try the Superman position. Hold your baby's arms out in front of them while they're on their tummy. This encourages the baby to strengthen their arms, neck, and back muscles. Studies from pediatric physiotherapists emphasize that this position mimics crawling motions and helps babies transition to moving on all fours more smoothly. A great strategy to encourage movement is tummy time with a target. Place a toy just beyond your baby's reach. This encourages them to lift their head higher and stretch their body. Over time, they'll develop the strength needed for crawling, and the visual stimulus will help them practice eye-hand coordination. Don't forget about side-lying positions, which are less common but highly beneficial. Lying on their side helps babies practice balancing their body and strengthens their muscles in preparation for rolling. This position can help prevent flat spots on the head while building strength for future milestones like sitting and crawling. Keep in mind that tummy time should be gradual. You don't have to introduce all these positions at once. Start with a simple, comfortable setup and introduce more challenging positions as your baby becomes stronger. According to Dr. Sears, a well-known pediatrician, building strength gradually allows babies to enjoy tummy time without frustration or strain. Chapter 5. Common mistakes parents make during tummy time, and how to avoid them. While tummy time is vital for your baby's development, many parents unknowingly make mistakes that can make the experience less effective. Understanding these common pitfalls and how to avoid them is key to maximizing the benefits of tummy time. One of the most common mistakes is not starting tummy time early enough. Some parents wait until their baby is older or more capable, but this can delay the development of crucial motor skills. The AAP suggests starting tummy time as soon as possible, even in the first few days of life. Even just a minute or two a day can make a big difference in building strength. Another mistake is doing tummy time only once a day. For optimal muscle development, tummy time should be a regular part of your daily routine. Experts recommend starting with short, frequent sessions, aiming for 15 to 20 minutes total each day. This can be broken up into several smaller sessions, such as 3 5-minute tummy times throughout the day. Not using enough variety is another common error. Sticking to one position, like laying flat on the floor, can make tummy time feel monotonous. As we've mentioned, different tummy time positions challenge your baby's muscles in unique ways. Variety keeps your baby engaged while strengthening muscles in different parts of their body. Some parents also give up too easily when their baby starts to cry. It's normal for babies to cry during tummy time, especially in the beginning. The key is patience and consistency. Dr. Karp reminds parents that crying doesn't mean they're failing. It means they're building strength. If your baby seems upset, give them a moment to settle, and try again. Over time, your baby will become accustomed to it and even enjoy the experience. Additionally, many parents overlook the importance of supervision during tummy time. Babies should never be left alone while practicing tummy time. According to the Centers for Disease Control and Prevention, CDC, always stay close by to make sure your baby is safe and comfortable. Babies can quickly become frustrated or tire out, so you'll want to be there to provide support and encouragement. Lastly, using the wrong surface can make tummy time uncomfortable or ineffective. Avoid hard surfaces or too many layers of soft fabric that might cause the baby to sink too deep. A soft, firm surface like a play mat or blanket is ideal. The right surface will help your baby lift their head and strengthen their muscles without the risk of slipping or discomfort. Chapter 6. When to worry. Red flags and signs your baby needs more help. Tummy time is essential, but what happens if your baby struggles with it? While some difficulty is normal, there are red flags to watch out for. Recognizing these signs early can help you take action if your baby needs extra support. One key sign to watch for is when your baby consistently refuses tummy time or shows extreme distress. Babies will naturally cry during tummy time, especially in the beginning, but persistent crying or avoidance can indicate discomfort or frustration. If this becomes a pattern, it's important to consult with your pediatrician to rule out underlying issues such as muscle weakness or physical discomfort. Another red flag is when your baby has trouble lifting their head or shows little head control after several weeks. Most babies will start lifting their head around 1-2 months of age. If your baby is 3 months old and still struggles to lift their head, it could be a sign of developmental delays. Early intervention is important in these cases, so don't hesitate to seek guidance from a pediatric therapist. Watch for signs that your baby is favoring one side of their head or body. Babies should be able to turn their heads freely in both directions during tummy time. If your baby consistently turns their head to one side or has a flat spot on one side of their head, it may be time to consult a pediatric specialist. Plagiocephaly, or positional skull flattening, is a common issue, and physical therapy can help correct it. Another concerning sign is when your baby is unable to bring their hands to their mouth or doesn't show interest in toys during tummy time. These are important milestones that indicate your baby's development is on track. If your baby is not reaching for objects or using their hands in a typical way by 3 months, it's worth discussing with your pediatrician. In some cases, difficulty with tummy time could be linked to other conditions, such as low muscle tone or torticollis, a condition where the neck muscles are tight on one side. If your baby seems overly stiff or is always turning their head in the same direction, these conditions should be addressed early. Torticollis can be treated with physical therapy and is usually easier to manage when caught early. If you're ever in doubt, don't hesitate to reach out to a professional. Dr. Sears reminds parents, you know your baby best. Trust your instincts, and don't be afraid to ask for help if you're concerned. Regular check-ins with your pediatrician ensure that your baby's growth and development stay on track. Thanks for watching. Be sure to subscribe for more parenting tips and developmental guides to support your little one's journey.